Welcome to Global Products Ophthalmology Specific EHR with help for clinical documentation. This is the main dashboard. To start with the clinical documentation, we will click on Patient to Consult. It shows a list of all the patients for the day. Click on name of the patient and the clinical management page opens up, which is divided into general ophthalmology and subspecialty. The topmost banner or the topmost part of the page displays the patient details. Coming to the OPD part, patient medical and social history can be recorded and it will get displayed as shown in the panel. Just click on add update and you can select from the options provided. Comments, if any, can be typed into the text box and saved. Next are the ophthalmic examinations and their corresponding findings. There are two columns. The left hand column displays the examinations names and the right hand column the associated findings. So we click on complaints. The findings will be displayed in the right hand column for right eye, left eye, and the finding details, if any, can be typed into this text box. Options can be selected by clicking on the checkbox. And coming to ophthalmic history, is a comprehensive listing of all the examinations and their findings. So if we click on cataract surgery, it will show a listing of all the findings. Coming to ocular examinations, which has vision, it has distant vision, you can select from the findings. As near vision findings, if we click on cornea, it show a listing of findings for cornea. And similarly for rest of the examinations. So for example, gonioscopy, iris contour, perimetry, intraocular pressure for shears digitally or with applanation. You can select from the findings, and once they are saved, they will be displayed in the examination panel. Next up is recording the diagnosis. MURX has an ICD-10 code database. So we click on diagnosis ICD and type in say for example retina. It will display all the diagnosis for retina. Similarly for cataract, can select from the listing and save it. The diagnosis type, onset date, comments if any can be typed in. Once it is saved, the diagnosis along with the ICD-10 code will be displayed in the diagnosis panel. MURX has a drug database, and a prescription gets generated from within the software itself. So click on add, just type in drop, show a listing of all the eye drops or ointment. Again, you can select from the list select the dose, drops, the frequency, months, the days, the eye for which the medication is to be prescribed, and save it. You can select any number of medications or drugs. For the diagnosis and save it. Next is the recording the clinical vision. Can record the values from the chart. Just select from the values and again save it, and the values will be displayed. Similarly for autorefractometer readings, select from the available chart and save it. For optometry, glass details for distant vision and near, select from the chart and save it. You can select either plus or minus vision values. For near values, again you select from the chart and save these, and the values selected will be displayed in the panel. Prism values, the glass type listing has been provided, glass material, once all the values are saved, information, clinical information is saved, the prescription can be printed. You click on this button which gives the prescription preferences. You can either print the prescription with the glass details, just a medication prescription, only the glass details, the diagnosis, header, footer, investigation and findings, which we will be seeing later on, and advice if any. We click on print prescription, and this is a sample format of how the prescription will print out. Depending on the prescription preferences selected. Next, there are certain images which can be edited using the built-in image editor. We click on the image which opens in the image editor. You can mark up the image and save it. Allergies also can be recorded based on drug allergy, food allergy. Contact lens details can be recorded. The type of contact lens or the model. There's a listing of type of contact lens and the name of the company. The values for K1, K2, ODOZ can be entered and the details saved. Intraocular lens details can also be recorded. A listing of the intraocular lens design based on design has been given. Select from the listing the company name, record the values and add it to the list. Then coming to the surgery module, there's a surgery module button which can be accessed by clicking on the surgery button. Ophthalmic surgery details can be recorded, clinical information can be recorded in this module. Any new surgery can be scheduled by selecting from a list of surgery names. Pre-surgery instructions can be recorded. And save. They will be displayed. The surgery date and time. The doctor or the surgeon notes, if any, can be typed in and it can be saved to the diary listing, which will show the list of surgeries and the dates on which the surgeries have been scheduled with their timing and the visit ID of the patient. Once the surgeries are completed, pre-post instruction and doctor's notes can be entered and saved. Surgery master option has been provided, wherein pre-surgery, post-surgery instructions and a name of the surgery can be added to the database along with surgery steps, if any. A discharge summary is also generated in MURX with the relevant details such as diagnosis, name of the surgeon, the associated surgeon, and prescription, the drugs which were prescribed. Investigations can be prescribed from within MURX by clicking on investigation and findings and selecting from a list of investigations to which can be added from over here. The listing can be modified or new investigations added along with their findings. Can select and the main investigation and can prescribe according to the date, the test and the investigation, and the findings can be recorded in MURX. Coming back to the clinical module, this was the OPD part. Next are the subspecialties in MURX such as cornea, cornea follow, injury, retina, keratoplasty, glaucoma, and pediatric. The clinical information for cornea subspecialty can be recorded in this cornea page. Information such as intraocular pressure, operative details, differential diagnosis, keratometry details, manual and auto K, topography, conjunctival swab, corneal scrape details can be entered in these text boxes and save. There's the injury subspecialty, history of presenting illness, examinations with the findings, classification of the injury based on mechanical, closed globe injury, open globe injury, the ocular trauma score can also be recorded, and the Roper Hall classification. Next is the retina subspecialty. Details such as color vision, diagnosis, complete anterior segment, retinal exam, investigations, the injection number and the date, keratoplasty subspecialty, ocular examinations, other details such as corneal pachymetry, axial length, intraocular pressure for Sheard's eye care, diagnosis, the operative details, post-operative information, histopathology details can be entered. Coming to the glaucoma subspecialty, medications and the dates on which they were given can be recorded. Patient history, anterior segment. This image can also be edited in the image editor. Intraocular pressure details, fundus examination information, perimetry can be recorded, and finally the pediatric subspecialty with clinical information to be recorded such as complaints duration, the birth history, vision IOP details, color vision, facial symmetry, squint motor assessment. Can also be recorded. This was the subspecialty module in MURX ophthalmology EHR. Wherein clinical documentation can be done by selecting the information as shown. So this is the global products MURX ophthalmology specific EHR with help for clinical documentation. Thank you.